The impact of nose surgery on airway function cannot be underestimated. In 2/3 of the patients that we perform rhinoplasty on, we aim at either preserving the nasal function or improve nasal function, meaning that we improve the nasal breathing, and by improvement of the nasal breathing, these patients sleep better and they have a better general airway function. What we try to prevent always, and that specifically accounts to reduction rhinoplasty, where we make the nose smaller, there we try to preserve the nasal function as much as possible, because we see a significant number of patients that come to see us for a smaller nose, a nicely looking nose with a small nasal tip, but we should make sure that by the reduction of the shape of the nose, we do not reduce the capacity of nasal breathing. So nasal breathing is an integral part of our aim during rhinoplasty, because either we want to improve the nasal breathing, maintain it, or prevent a reduction of nasal breathing.
First of all, I'd like to think that every time we operate on a nose, we will improve the nasal airway, if there was a problem to start off with. So generally speaking, the airway function should be optimal. It's only on occasions when the nose is narrowed too much and when the surgeon has not taken enough precautions to reduce the scarring inside the nose, patients can get nasal obstruction. But to summarize, I would say that rhinoplasty surgery will actually improve patients' nasal airway.
For the patient, often it's an important issue. They want more air through their nose. If you physically don't enlarge the airway in there, but redistribute the air that is in the nose, basically you're not enlarging anything. So it's in rhinoplasty patients, it's often a subjective sensation of airway function, which in my opinion is the whole problem with trying to objectify nasal passage and coupling it with subjective symptoms. So we have problems with doing that. So all our objective measurements are only, to a certain extent, linked with subjective improvement. It's important for our patients to know this, and it's very hard to promise. So what you want to achieve basically is a symmetry in nasal airway passage on both sides. I think that's more important than the actual size of the nasal passage itself.